that can go into these homes and jump into a crisis.
In Canada, we shouldn't have soldiers taking care of seniors.
As the military prepares to deploy to long-term care homes in Ontario, we are getting a clearer picture of just how many people are dying in these facilities. Ottawa has agreed to Ontario's request for Canadian Forces to help at some long-term care homes. The approval comes as new numbers from provincial officials show that 70% of COVID-19 deaths in Ontario are happening in these homes. The dire situation is even personally affecting the Premier, causing him to become visibly emotional today. Lisa Shing now with the latest.
When I see the front page of the Toronto Sun and you see a loved one with their elderly parent and they put their hand up against the window, that's heartbreaking.
Referencing this photo from the Toronto Sun today, Ontario's Premier got choked up over the situation in the province's long-term care homes. What he didn't say, his 95-year-old mother-in-law has tested positive for COVID-19. An outbreak at West Park Long-Term Care Home in Toronto, where she lives, has taken the lives of 13 residents.
I relate to it in our own family, as I mentioned, with my wife Carla. And or the person that got on a cherry picker. Anyways, the system, we can do better.
He's referencing the great lengths people are going to see their loved ones as the virus continues to spread.
My heart breaks for the people and the families.
As of today, the province is reporting more up-to-date numbers. More than 500 long-term care residents have died.
We are failing our parents, our grandparents, our elders.
The federal government has agreed to send troops into Ontario's 5 hardest-hit homes, but the Prime Minister also had this message.
But this is not a long-term solution. In Canada, we shouldn't have soldiers taking care of seniors. We will all have to ask tough questions about how it came to this.
So far, we don't know which 5 homes will get the help. Ontario's Chief Medical Officer of Health says each home will have a team of about 50 troops trained in medical services, including a nurse. They'll be doing other tasks as needed as well. Lisa Shing, CBC News, Toronto.
Also today, the province extended a number of pandemic emergency orders that had been set to expire. The orders mean parks and recreational areas, non-essential workplaces, and restaurants must stay closed until at least May 6th. A Mississauga family is pleading for an exemption to the strict COVID-19 rules so a mother can help care for her adult son. He's quadriplegic and lives at a care facility where his family helps to take care of him. But without that extra support, he has ended up in hospital. As Lorenda Redekop tells us, the family feels this could have been prevented.
We told them we are afraid that this is going to happen. He's going to need oxygen.
The family of Quinn Carter expected his condition would worsen once visiting rules tightened at the Moyer Centre for Complex Continuing Care where he lives. He's 47 and was severely injured in a motorcycle accident in Vietnam 4 years ago. The former engineer is now quadriplegic and nonverbal. His mother would often stay with him overnight. Mucus builds up in his airways and she'd suction it out. They say staff couldn't check in as often.
Just put everything into taking care of Quinn, and it was really effective because he didn't need even supplemental oxygen. He was fine.
In part due to his stable condition, she was denied an exception that would have allowed her to visit. He's now in hospital in ICU. Thankfully, they say he's off a ventilator as of yesterday.
Can you imagine constantly not being able to, you're constantly feeling as if you're drowning and you can't get up, you can't get that breath. It must be a terrible feeling. And I had promised him, I said, Quinn, you're not going to suffer. And then I was asked to leave, and it was just, I felt guilty.
A group that works with disabled people and their families says they're not alone.
It's causing a high degree of stress for the individuals and for their family members. And, you know, we have seen some cases where there have been exceptions made, but they're very, very, very few and far between.
The family has written to the facility and also to the Premier and top health officials, pleading for help. Trillium Health Partners runs the care centre. It says it's following provincial guidelines for visitors, but has made 2 exceptions at the care centre where Quinn Carter lives. It also says if a patient's health status has changed, a family can reapply for an exemption.
You know, nothing is black and white. You always have to look at specific cases, and no one was looking at it.
Joy Carter says she'll definitely reapply for an exemption if and when her son is out of hospital. Lorenda Redicop, CBC News, Toronto.
Prime Minister Justin Trudeau announced a major investment in Canadian work on effective testing and developing a vaccine.
We're putting in place an additional $1.1 billion for a national medical and research strategy to address COVID-19. This plan has 3 pillars: research on vaccines and other treatments, supports for clinical trials, and expanding national testing and modeling.
A key objective will be to ensure the ability to mass produce a vaccine here at home so as to bypass what will likely be fierce global demand. In the short term, controlling the spread means blood and antibody tests and getting a grip on how long immunity lasts. A new COVID-19 immunity task force will be led by a group of experts, including Dr. David Naylor, who provided expertise with SARS back in 2003. It is aiming to test at least 1 million Canadians over 2 years. The TTC says it will temporarily lay off about 1,200 employees as a result of COVID-19.
2/3 of the revenue generated for the TTC comes through the fare box. And up till now, we've lost 85% of our ridership. So we've really become financially tight when it comes to having revenues come in. This was an incredibly tough decision today, but it really was a decision of last resort.
That includes 1,000 transit operators and 200 non-union positions. Leary says that the transit agency has been trying to manage the impact of COVID-19 since January, but the revenue loss from low ridership has equaled about $90 million a month. The TTC says it is hoping that both the provincial and federal government step in to work with the transit agency, something Mayor John Tory is also calling for.
Our need this year from the Government of Canada and the Government of Ontario is for operating funds to help us make up the difference that we've lost because of reduced TTC revenue and a variety of other things.
The union representing those workers also agrees, saying both levels of government need to step in. It also released a statement in response to the announcement saying, "That's the thank you our members get for sacrificing themselves day in and day out, putting their families and themselves at risk. Staff who are affected will receive benefits through the fall." The TTC says service will continue at about 75% of regular levels. Despite all the efforts being made by the Canadian government, some businesses won't survive COVID-19. A new survey shows that half of Toronto's restaurants may disappear if conditions don't change in the next 3 months. Natalie Nanowski takes a look at what that means for the future of Toronto's vibrant food scene.
It was an icon, attracting people to the East End before it was hot.
So I'd like to identify areas that I thought were up and coming. So I saw Leslieville as being one of those areas. So we opened up, we started construction 2006, opened it up 2007.
13 years later, it's closed. Even though it weathered the 2008 recession, this crisis is harder since Prohibition's model isn't conducive to takeout.
We made a lot of money because we did late night. So Friday, Saturday night, it turned into, like a nightclub atmosphere, so to speak. And if your menu is not set up in a way to actually facilitate takeout, like certain things just don't go on takeout.
Even businesses that have converted are struggling to attract customers. A new study by Restaurants Canada found that half of the country's restaurants don't think they'll survive more months of lockdown. So Toronto's 9,000 bars, restaurants, and caterers will go from this to this.
If you have that many restaurants closing down, you are going to see fewer choices.
So what does that mean for the city's bustling food scene?
It's not going to work with social distancing. Because you could, if you're making, between 5 and 7% net profit at 100% capacity, what are you going to do at 30?
our current system may need to change. For Guy Rawlings, opening up his wine cellar to the public is keeping him going.
I think it's something that should continue afterwards. And it was a really smart move. It definitely is allowing businesses to create revenues that they weren't able to do.
Other than his famous bread, he's not selling many menu items, but he's paired up with a local farm to keep his farm-to-table model going with organic groceries.
Right now we're figuring out the new dynamic with the food box, so we're really not sure what it's doing for us quite yet.
And that uncertainty is running through the industry as restaurants try to stay afloat with creative solutions, because it is going to be a while before we sit down to a full-service dinner. Natalie Nanowski, CBC News, Toronto.
Cold and cloudy, Colette, but we hear a change may be coming.
Yes, a change is coming within the next 24 hours, Dwight. So this is really nice to see that we're going to warm up back to double digits. I actually looked because it felt like it'd been so many days since we'd had double digits for an afternoon high. It was just back on Monday. So it's only 3, or if you count today, 4 days ago. But we've had a string of cooler days, and so we deserve this one. Warming up tomorrow afternoon. It'll take some time for the clouds to break away, but we'll start to get some sunshine after the noon hour. And then a repeat in terms of being mild Saturday as well. Saturday night into Sunday, those showers will move in, and then it's a wetter and somewhat cooler and windier day into Sunday. Current temperatures, they show you what's going on here, because we go from these 5s to look at this 2 degrees at Hamilton, where earlier today, or at least in this region, there were some ice pellets, and you can see why the temperature is down. An easterly wind, but also this is where some of this rain is, and look at how it just hugs right along that front line. So that, all that rain, now some of that is going to start to rotate a little bit further north as we go into the evening hours, but it also breaks up. So as it does, we may see some light showers or a little bit of mixing, and then just kind of disappears. However, the clouds don't. They're going to take more time to get out of here, and that's why I say tomorrow afternoon it will improve as the day wears on, and the more sunshine we get, the better we're going to do with that temperature. The setup for Saturday is very nice. And as I said earlier, it does get a little wet into Sunday. I'm going to go into some details of the timing of that and how much rain we'll see coming up. Just know tonight we go down to 2, and there it is, Dwight, 11 degrees tomorrow. So it's Monday. It was only Monday.
We'll check back with you in a bit. Thanks, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
The holy month of Ramadan will officially begin either tonight or tomorrow, depending on the first sighting of the moon. It's a time when the Muslim community comes together to celebrate and pray. But things are going to be very different this year. Mosques around the city are struggling to find ways to keep up with tradition while still following those physical distancing measures. Greg Ross explains.
Actually, we are very sad that there is nothing we can do. We just, as I said, we just have to follow the rules.
Al-Haj Abubakar is the vice president of the Omar bin Al-Khattab Mosque on Parliament Street. He says during Ramadan, they normally get 600 to 800 people at the mosque every night. This year, they're telling members to stay home during the Muslim Holy Night because of COVID-19.
Individually, we pray at our homes with our family. That's what we do.
It's a stark contrast from the norm. Ramadan is usually a time to be together, which is why some are looking for ways to carry on that tradition.
What we wanted to do was bring the masjid feel and bring the atmosphere and bring the knowledge into everybody's home this Ramadan.
Akbar Ali is with an organization called Penny Appeal Canada. They're offering online services every night during Ramadan.
Actually, all of our imams are programming. They'll be making a actual prayer there that everybody can join in on for 2 to 3 minutes. And then what we do is we have what we call the call to prayer. It's called the adhan. And we'll be playing that right when it's time for people to break their fast. So then everybody around their house, they can break their fast and eat together then.
Other groups are trying to move their services online as well.
We have clothing vendors, we have jewelry vendors, footwear vendors.
Sabina Ali is the executive director of the Thorncliffe Park Women's Committee, which organizes an annual Eid Bazaar.
We are planning to create a virtual bazaar platform for the vendors and for this community so that they can, buy clothing, jewelry for the coming Eid.
But not all services can simply be moved online.
This is also a time of charity and a type of giving.
Soraya Ibrahim volunteers with a group called Muslim Welfare Canada.
Where are these meals going? So we are taking to the senior building.
They're already providing meals twice a week to vulnerable people during the COVID-19 pandemic. During Ramadan, they usually organize meals at a mosque every night. They still plan to do it again this year, only the meals will be to go.
It won't be the same, definitely, but still there is people who are helping out.
And it's happening at mosques all over the city. Greg Ross, CBC News, Toronto.
A lot of small business owners have switched to online sales after COVID-19 caused them to close up shop. And for some, it has been a rough transition. They've been relying on Canada Post to get their deliveries out, but the carrier is struggling to meet the increased demand while facing its own challenges caused by the pandemic. Talia Ricci has more.
These two Queen West stores made a quick switch, moving business online during COVID-19. But they've both experienced an additional hurdle, getting the products to their customers.
There's some things I don't even know where they are. And I still just shipped out something else new to the person because I don't think it's the consumer's fault.
It's been hugely stressful because it's the only thing we can do properly at this point is to get people's packages out to firm and make the sale. I feel like I'm going to be on the hook for all of these packages that have gone missing.
Canada Post admits there are delays. On Monday, they shipped out 1.8 million parcels, which is the kind of volume they see around Christmas time. That, combined with the new safety measures, is slowing things down.
Consumers don't really see that, but it means that we've put physical distancing in places that were never designed for people to keep people more than 2 meters apart.
Hamilton says checking the package's status online is still the best way to keep track.
For the customers ordering, if you're buying something local, and I certainly have been doing that, have a little bit of patience.
Both women said their customers have been patient.
But that doesn't stop people from emailing me saying, where's my package? So for every query, I've got to spend an hour on the phone with Canada Post. So it's very time consuming.
And when time is being spent trying to figure out how to run a new type of business, the owners say they can't be wasting it.
I've made it right with all my customers and switched to a courier that seems to be working really, really efficiently. And yes, it does cost more, but my customer relationships are more important to me than that cost.
Talia Ricci, CBC News, Toronto.
Do we know if they've cut the ceiling?
After the break, here are the recordings from RCMP as they hunted the man who committed Canada's deadliest mass shooting in Nova Scotia this weekend. Plus, remembering a tragedy here in Toronto 2 years later.
It was something that just fell silent, almost like a movie shoot. When you drive by a street that's closed for a movie shoot, you see all sorts of things that are kind of happening in silence, but the look on people's faces was really something.
We have new information tonight about the man responsible for the deadly rampage in Nova Scotia. CBC News has confirmed that he confronted and forcibly restrained a woman he was in a long-term relationship with late Saturday night. Then over the next hours, he killed 22 people in a violent rampage while masquerading as a police officer. Simon Dingley has more on what was a frantic search for the killer.
In the moments after the late-night shootings and fires began, the situation was chaotic as police scrambled in the dark to find a killer who was masquerading as one of them. CBC News has obtained emergency services communications recordings. Though calm, police sounded confused.
Is there also a structure fire out this way? Nothing I get reported. We're seeing huge flames of smoke from where we are. Do we know if these, cut the ceiling? No, not for sure. It's in quite a ways, the actual house. They're bringing the victims out to that intersection from the actual scene. But no, they don't know if they've caught them. I don't know.
With so many unanswered questions, Nova Scotia's Premier is pleading for patience.
There's a lot of people hurting in this province. There's no question, and I get the understanding and I get the desire why people want information readily available today. These are complicated sites, but I think we need to allow this process to happen.
Today, the Prime Minister acknowledged the difficulties police and the community are facing.
I spoke also with RCMP members from the area, and on behalf of all Canadians, I thank them for their service. Yesterday, I spoke with the families of some of the people we lost. They shared stories about their loved ones and their dreams and plans.
Meanwhile, Halifax police removed this decorative sign from a building where the gunman ran his denture business, much to the relief of residents.
The guy committed one of the worst crimes in Canadian history, and just having this weird, creepy grin he put up on the side of his shop, just staring at people day after day, it's really bad for the community, so I'm really glad they took it down.
Tomorrow, a day of mourning is being held for victims of the attack. The Mounties are asking Canadians to wear something red in honor of Constable Heidi Stevenson and the others who died. People are also being asked to share messages of support during a large virtual service being held online and on TV Friday evening. Simon Dingley, CBC News.
For Torontonians, I know it'll be a hard day as well, as we remember the victims of the van attack on Yonge Street 2 years ago. Together we mourn, and together we heal. Because just as Canadians were there for each other 2 years ago, we're there for each other today.
A virtual vigil is taking place today to remember the lives lost 2 years ago when a van barreled down the sidewalks on Yonge Street. The groups We Love Willowdale and the Willowdale Interfaith Coalition are bringing people together online to help the community grieve. Linda Ward has more.
It's sad. It's a very sad day.
Members of the Willowdale community say they'll never forget where they were when the van attack happened.
I was doing my nails and I heard it there. I couldn't believe it.
It's 50 meters from where I live. My wife heard and thought people dying. She thought it's her parents on the street because they were out from the building. It's horrible.
The pain here still raw. The once again empty streets reminiscent of the aftermath of the attack. But Nira Mallis also remembers how the city came together in the days that followed.
I just couldn't believe it. I still can't. And I just remember this. All the flowers everywhere.
There was a silence that fell over the area, like a movie scene, and everything was just quiet. But people did have a really look of terror that saw things, and they needed support, and there was people there to support them.
Save for this one bouquet left here by a Toronto police officer this morning, there will be no flowers, no signs, no public memorials. The city has asked us to refrain due to COVID-19. Instead, Mayor John Tory issued this live stream statement this morning.
While we gathered then, and we'll gather virtually now, we remain strong and united. The challenges today remind us of these strengths and the unique values of our city and of our community.
At the hour of the attack, the city lowered the flags at North York Civic Centre and Nathan Phillips Square and will dim the Toronto sign tonight in memory of the 10 people who died and the 16 others who were injured. Their family members had anticipated spending today in a courtroom, attending the trial of the accused, Alec Manassian, that too put over by the pandemic.
That's what we have to deal with. It must be very hard, you know. But everything is not easy.
We'll remember them all in our own way, but it's sad. And if we all work together, even though we're apart, we can do that.
Linda Ward, CBC News, Toronto.
After the break, chefs are moving from restaurant kitchens to their own and heading online to show you how to create their specials. We'll have that for you coming up. The urgent care center at Peel Hospital is temporarily closing down.
We've decided to temporarily close the urgent care center so we can utilize that staff to assist in the very critically ill COVID positive patients. We will redeploy those staff to our ICU units or to our inpatient units where we have COVID-19 patients.
Dr. Mohammed says the urgent care center at Peel Memorial is seeing about 30% of its normal volume. The temporary closure takes effect tomorrow at 9 p.m. Patients who still require urgent care can be seen at Brampton Civic or Etobicoke General hospitals. The pandemic has put a pause on all but the most urgent operations in Canada's hospitals. Now surgeons and specialists are preparing to tackle the enormous backlog. And as Nicole Ireland shows us, the waiting has taken a real toll on some patients.
Sherry Beatty loves spending time with her rescue dog, Lily, but her irregular heartbeat limits what she can do.
It's like a washing machine that's off balance when it's in the spin cycle. Like it just beats faster and odd. The fatigue, shortness of breath.
After waiting almost a year, she was finally scheduled for a cardiac procedure to fix the problem at the end of March. Then it was abruptly canceled due to COVID-19. Her husband Jim suffered a heart attack in February and had bypass surgery in March, just under the wire. The most urgent cancer and heart and stroke procedures have continued, but an estimated 15,000 to 20,000 cardiac procedures have been postponed, according to the Canadian Cardiovascular Society. When you factor in everything else that stopped, from cataract surgeries to hip and knee replacements, the surgical backlog could add up to as many as 100,000 patients across the country.
The surgeons have been most worried, and they're just seeing these waiting lists growing, and anxious patients are phoning back and worrying and so on.
There is a glimmer of hope, but it's fragile. University Health Network in Toronto is starting to perform a few more cancer surgeries and organ transplants this week. If it can continue ramping up, the surgeon-in-chief hopes to catch up on time-sensitive surgeries by the fall. But to do that, hospitals need government funding to run operating rooms during evenings and weekends, a reliable supply of personal protective equipment, and COVID-19 test kits for every patient before undertaking surgery. And if COVID-19 cases rise again, surgeries will ramp right back down. So the best way to restore surgical procedures for people like Sherry Beatty? Continue following public health guidelines, like staying home. Nicole Ireland, CBC News, Toronto.
And as medical appointments get canceled or moved to phone and video chats, there are fewer supports and services for new moms in self-isolation. As Jason Vio explains, there's a heightened concern now around postpartum depression.
Karen Slyman expected many sleepless nights and countless dirty diapers with a 4-week-old baby. But what she didn't plan for was giving birth during a pandemic and the lack of support that comes with it.
I'm doing the best that I can. Some days it's not so bad, and other days it's really tough.
It's more difficult with early years centers closed. No mom groups, no in-person supports, no classes, and no physical interaction with the friends and family you'd planned on being there for these early newborn weeks and months.
So I tried really hard to look up all these community resources. Then I basically didn't have access to them, or if I had access to them, they were limited to Zoom calls or telephone calls, or none of that in-person contact, where sometimes you just need somebody to hug you and say, it's okay, it's really hard. And I couldn't get that.
She's worried about postpartum depression, and so too are experts.
It's very concerning. You know, isolation after having a baby is a real thing, even in the best of times.
A lot of the resources that were there to support postpartum women aren't there anymore.
The regional health unit in Windsor, Essex, for example, shifted almost all of the nurses dealing with new moms to help with the COVID-19 crisis.
We know that postpartum depression is fairly common, and that it is a very significant health concern.
To help ensure the feeling of the baby blues doesn't turn into depression, Slyman has been keeping her friends and family close, virtually. And one moment that was both heartwarming and heartbreaking, her parents drove 3 hours from Hamilton to visit their granddaughter for the first time through a window.
And it was just a 5-minute yell through the glass conversation. And it meant so much to me. And that was so wonderful. but my heart just broke.
Jason Vio, CBC News, Windsor.
And if you or someone you know is dealing with postpartum depression or other mental health concerns, help is available. The province has a service called Connects Ontario, which includes support for mental health. From online schooling to kids being stuck at home, life in the age of COVID-19 has parents confronting some new challenges. But for parents of children with potentially life-threatening medical conditions, the pandemic has added a new dimension of stress to what was already a difficult circumstance. Stephanie Matisse explains.
This little cutie is Gage. He'll be 3 next month. He has a deadly allergy to milk and eggs, and he also has asthma.
He will be itching till he bleeds. He's sucking in very hard for breath. It's very stressful. My anxiety gets pretty bad.
One of the biggest stresses for his mom is going for groceries, especially right now.
The thought of going anywhere to do anything, it's instant panic about what if somebody's here that's been sick, what if I take it home to him? I don't think that fear ever goes away.
And when people were panic buying,
Excuse me, sorry.
some items that her family depends on for her child's safety sold out.
I will only buy a certain amount from each store so that I'm leaving some behind for other families who might have allergies, because I don't think a lot of people think about that.
If you are dealing with
Parenting columnist Ann Douglas says kids and COVID is a tough combo, but harder for some families dealing with pre-existing health conditions.
I have never been involved in so many calls as I have in the past week or two, where parents were sobbing, not just anxious, not just feeling a little bit stressed, but completely falling apart. This is hard for everybody, but for some people, it's almost unspeakably difficult.
Help each other, she says.
Draw upon some of your earlier strengths. You've already learned how to wrap your head around things that are still unimaginable to most families.
Marnie Halter's 2 boys have 7 life-threatening allergies between them. During the pandemic, it's more important than ever to stay healthy.
We don't want to put extra pressure on the medical system, and because we don't, want to be in a hospital unnecessarily, and this is something that we can control.
She borrows a mantra from Food Allergy Canada: to be careful, not fearful. Stephanie Matisse, CBC News, Toronto.
It is a scene we've seen often during the pandemic, the community coming together to thank our healthcare workers. But today, other frontline workers wanted to show their appreciation to doctors, nurses, and staff at Brampton Civic Hospital.
Canada Post employees are frontline workers, and the hospital workers, the police force, our first responders, they're dealing with the COVID-19 crisis hands-on. So we're all in this together. We want to show support for those first responders, and so today is just the day where we can do that.
It's important to us. For us, it hits home. A lot of our employees have family members and friends who are working in those hospitals, even this one in particular, Brampton Civic. So it is very important to us that we show our support in any way that we can.
We're overwhelmed. It is this expression of kindness causes great resilience amongst our staff. It allows them to really appreciate the community's support and come in every day to do the job that they know they need to do. Well, there's the challenge of fear and anxiety, because this is a very dangerous contagion. They are afraid for their families, and they're getting tired, because this is a grueling job, day in, day out.
Oh, we're feeling excited, thank you.
It really lifts the spirit, doesn't it? When you see some of these signs. That little, the child in the front seat who said, kick COVID ass, kick COVID butt, sorry. You know, he's putting his heart into this as well.
You have probably been cooking a lot more than usual, and with many restaurants closed, some of our favorite chefs are helping out home cooks. Eli Glasner joins us to talk about what is happening online, Eli, but how are chefs then using Instagram in particular to help us?
Hey, Dwight. So what's happening, every night on Instagram in between those DJ parties, there are kitchen parties. And so what's happening is those chefs that are sheltering at home, that are isolating, are creating like a new genre of chef television. Call it quarantine cooking. And so the idea is they're reaching out to their audience. They're trying to connect. They're trying to give us ways to stay safe and how to cook with just what we have at hand. And many of these chefs are like, big fancy celebrity chefs. Anthony Peroschi, you might know him from the Queer Eye show. Italy's Massimo Bottura, one of the most well-rewarded Michelin chefs ever. Ina Garten and many more. I was actually speaking with Devin Rajkumar. He's known as Chef Dev. You might have seen him as part of the Food Dudes crew. He's often on Cityline. He's used to traveling around the world and picking up all sorts of international cuisine. Well, now he's at his parents' place in Richmond Hill. And so, like so many, he is connecting with his audience and he's sharing practical tips on how to just make the best with what you have. Because right now, it's not about being fussy. It's just about providing soulful food that we can enjoy together. Take a listen to Chef Dev.
Trying to get dinner on the table, like I'm cooking for my folks and stuff like that. But there's a lot of people out there, the mothers and fathers who have 3, 4, 5 children at home. They can't be fine straining their soup. Like they need to get the thing on the table, right? So
there you go, right? Yeah, we don't have time for that. It's about, as David Chang said, nourishing. So we want to feel good. We want something that's easy. Maybe chefs can show you how to pick up your game. And one of his first videos was craft dinner, but with truffles. So bringing KD to the next level, Dwight.
Wow, with truffle, I would love to try that, but I don't know about their putting the soup in the strainer. Okay, what are chefs saying about how COVID-19 is going to change their entire industry?
It's really quite something. You look at some of the predictions, they're saying like 75% of the industry or more is really on the edge. I mean, this is an industry in good times with tight margins. Now you got to think of how to reopen a business with more space, with less tables, less paying customers. I talked to Gail Simmons. Now she is on Top Chef. She grew up in Toronto and she sees a real dramatic change ahead for her industry, kind of going back to their roots about just creating good, nourishing meals. But she is a Toronto girl, so I had to ask her, what would she order into her place if she was in Toronto right now? And take a listen to this delicious laundry list.
All the great dim sum in Chinatown right now, all the delicious dumplings and soup, the Lobster Fish House up in Scarborough, Towers, I mean, that's really a luxury.
Yeah.
So many places. Oh, I would want anything cooked by Chef Anthony Rose at any number of his restaurants. I would want Dilo on College to give you some takeout. I could go on and on.
So Top Chef's Gail Simmons in Brooklyn, but lots of love for Toronto, making us all hungry and giving us, hope for a place where we can all dine as a group together again. And until we can, hit on Instagram and see what your favorite chefs are sharing, all those great recipes that you can try at home tonight.
Well, if you weren't hungry before, thanks, Eli.
You're welcome.
Can you hear it, call it? My stomach grumbling.
Yes.
From Eli there. But it's important that we support some of these local chefs, and they're supporting us in turn with some ideas.
Yeah, the Fish House, Dilo. I mean, she mentioned some good ones there too. It's like, oh, I can't wait till things get back to normal. At this point, I'm on my own tonight, wondering if I can get away with just making myself a bowl of Raisin Bran. That's about the size of it for me. So I might have to check out Instagram as well. I want to show you what's going on here. These are the sustained winds, and just have a look at Hamilton in particular, because we are looking at those winds coming in off the lake. Not only that, but you add to that some of the rain that's in the area. And so the temperature there, 2 degrees, London at 2 degrees as well. But elsewhere, we're seeing readings of 5 to up to 8 degrees in terms of what the current temperatures are. And this had an impact on daytime highs too, but look at this line all along this frontal boundary, kind of just to the north of it. So all the way back from Kalamazoo to east of Syracuse, we're seeing that rain, and some of it heavier right through here towards the Niagara Peninsula, back back through London, Sarnia reporting rain showers as well. We'll see that weaken somewhat, but it is going to rotate a little towards the north, and that's why we'll likely have a few showers making their way into the GTA. And then as we go through the overnight and into tomorrow, we're still holding on to some of this cloud cover into the afternoon. On Friday, we should see that breaking up, and we'll get some sunshine coming in. Then we go into Saturday, a nice setup to start the day off. Then the next system is going to be coming but skirting south of us. This one probably even further south at first. Could bring some heavier rain into southwestern Ontario overnight Saturday. We'll see showers developing towards the GTA, and then those linger into Sunday. And not only that, we'll see the winds picking up on us, and the temperatures are going to be a little cooler. So we've got a couple of days, Friday, Saturday, with some nice temperatures, and then it does get a little chillier there for the second half of the weekend. Now, this is Sunday night. See that timestamp there? So some of this may even linger Sunday night into early Monday morning. The temperature will be staying above freezing, but it could get a little bit of a light mix there into Monday morning before it clears away. Overnight tonight, then, that risk of seeing some showers, lows around 1 to 2 degrees, and then there you go tomorrow. It is going to be slow in coming, it seems, but we will get some sun, like I say, sort of breaking through the clouds and then seeing the clouds eventually breaking up. So highs of 10 degrees. That's St. Catharines, 11 degrees elsewhere, especially where you get more sunshine and a little bit sooner. Now, Saturday, 11 as well for the afternoon high. There you go, Sunday, 8 degrees, but with the wet conditions, with the winds, it is going to feel a little bit cooler than even that. Monday, up to 10. Tuesday, not bad. We've got a few days here, once again, where we're looking at double digits, but Tuesday night, right into Wednesday, showers come back on us.
Thank you, Colette.
You're welcome.
If we remove these measures too quickly, things will resurge.
So when will life get back to normal? We'll take a look at how Ontario could get there next. The province announcing today it is extending the emergency orders originally put in place more than a month ago, which has many asking when life will get back to normal in Ontario and how do we get there. While there are no easy answers, experts agree moving too fast could have dire consequences. Lauren Pelly explains.
For weeks, we've all been missing our favorite shops, restaurants, and venues. But policymakers can't just flip a switch and bring our neighborhoods back to life.
I got to be very, very clear. There's never going to be one date that we just open up the economy.
In fact, the province has extended all emergency orders until early May. That means non-essential businesses stay closed, and gatherings of more than 5 people are still banned.
If we remove these measures too quickly, things will resurge.
Epidemiologists warn without restrictions in place, COVID-19 cases could keep rising. That means these restrictions have to be lifted gradually. City officials are now trying to figure out how exactly to do that.
I think we're just in the midst of doing a lot of planning because it's very complex planning that has to be done.
We would be certainly trying to avoid crowding and congregations and large gatherings. But there may be certain businesses where, activity could be turned back on, but could be done in a way that it actually still allows for appropriate physical distancing to occur.
So does that mean small shops and cafes could reopen before big gathering places like arenas and stadiums? Officials won't say, and there's no clear timeline either.
That's going to be a while. I think that's only going to be when we have a vaccine. And that's probably, at least a year away, at least a year.
So what's the bottom line? Well, getting back to normal is going to take time, patience, and a lot of planning.
Yes, it will. After the break, today's Frontline Heroes. Stick around for that. We will be right back. Every day, Salman Hassan says he sends his two sweethearts to face the COVID-19 pandemic head on. His wife, Dr. Aliyah Salman, is a staff anesthesiologist at Mount Sinai Hospital. His daughter, Dr. Maria Salman, is a second-year anesthesia resident at the University of Toronto. In an email, Hassan told us, the N95 mask with the nose metal brace leaves a mark on their faces after extensive use, adding, it's hard. I have numbed my mind and I pray for their safety and for every frontline worker battling the pandemic wave and treating the sick. So, thank you to Dr. Aliyah Salman and Dr. Maria Salman for all your hard work. If you would like to share a story about your frontline hero, just send us a selfie-style video explaining why they are a hero to you. Tag us on Instagram or on Twitter at CBC Toronto. Send us a message on Facebook or just email us at cbctips@cbc.ca. And Colette, people have been writing in, but everybody's camera shy. We're like, send us a video and shout out your frontline hero. But a lot of folks, we'll put them on TV. Tell them, Colette. It's
yeah,
okay.
we would for sure like to see that. And your sweethearts. I loved how you called his sweethearts. Yes, that was very nice. Yeah, we have, okay, this is a terrible segue, but about a sweetheart of a line of showers here that we're seeing all the way from east of Syracuse back towards Kalamazoo. Look at that line, all along a kind of frontal boundary that's just a little bit further south. So that's why through Niagara you've got the wet conditions in London and back towards Sarnia. Now this will be weakening somewhat, but it may rotate just enough to the north that we could see some stray showers then coming towards the GTA. So that risk is there this evening, 3 degrees, 2 overnight tonight with a lot of that cloud cover hanging in there. So that's still going to be there into the morning hours, but then we'll see it eroding as the day wears on, and that's setting us up for a much nicer afternoon. And not only that, but to see our temperature get up there, climbing above 10 degrees, 11 for the high tomorrow afternoon, Dwight.
Thank you, Colette.
You're welcome.
And the viewers say you can keep that sweetheart line of showers. We're good.
Yeah, that's right. We don't need it.
We don't need it. The flowers do, though. That's our show for tonight. Thank you for joining us. Mike Wise has your next local news tonight at 11, right after the National. Stay safe, everybody. We'll see you back here tomorrow.